go over a couple points. So I updated Moodle. I threw in a bunch of different things. One is I updated old hip lecture stuff in case you want to go ahead. It's probably going to take us 2 days to go through the muscle of the hip. In addition, I posted old lecture videos for your final exam. So that's all up there in case you want to get a head start on looking at that kind of stuff. Okay. The hip has a lot of muscles, not just because it takes a lot of force to move everything on top of it, but stability as well. You can run away from danger with a dislocated shoulder. Getting away from danger on your own with a dislocated hip is not a good thing to have. So in addition to having mobility muscles, a lot of those muscles serve as stabilizers as well. So we just have a lot of them. I try something new today. If it works, great. If not, sorry, I'm always trying something new. We'll start off with a few examples first to kind of retrain our brain on what we're talking about. Then we'll go into the muscles that pull in those specific directions, okay? So a couple of things from the knee perspective, going down, knee extensors, right? That makes sense because the squat's trying to flex me. All your circles tell you is who are those muscles? Who are the extensors? Well, the ones in the front. My quad, vastus medialis, lateralis, and medius rectus. So the circles don't tell you if they're working. You have to kind of figure out from 310 who you need in terms of group, and then the circles help remind you, or your list. Again, I don't care how you learn them. Who are the muscles of the quad? That's what we need to know. A little bit of caveat. Do you know how in that picture on the right, you can maintain that position? You can put a lot of weight with a locked out position. So what's going to unlock your knee? That popliteus muscle, right? That popliteus technically is a knee flexor, but you have to unlock so that you can start using your quads, right? So if I ask a question like that, it'll be very specific, very nuanced. There's no logical reason for me to say you go all the way down on a squat or you go from left to right. You're not working your popliteus through that whole range of motion. The popliteus just unlocks so that your quad can take over. Does that make sense? Like, you're not going to be working the popliteus all the way up and down. Okay, it's a knee flexor. What about the hip? Hip flexors or hip extensors? Hip extensors. Hip extensors is the group. I need muscles that pull that way because the squat's trying to flex me. My circles are going to help to remind me who those major hip extensors are, or your lists, or wherever you want to do it. But the lists or your circles don't tell you who you need. Once you identify who you need, they just help to remind you who they are. Who are those major muscles? Because like I told 310 guys, we are above, I say above, I'm not talking about in status, but this is a profession, kinesiology, that anyone can practice. Anybody can get a gym membership, and for the gym membership and those exercises, they're not going to say popliteus, gracilis, sartorius, right? They're just going to use layman's terms: hamstrings, quads, glutes, calves, right? I mean, so we have had that mindset our whole lives. So it's hard to not get into those illusions of the quads and the glutes and the core. And there's a place for that. I'm not saying that's wrong for people that aren't trained in kinesiology. We need to be above that. We need to know who the quads, and we need to know why they influence motion. Not because their name is quads, it's because they pull in a specific direction, and they're going to influence motion a specific way. Okay. All right, how about this practice before we get into the hip musculature? Who am I stretching at the hip? Flexors or extensors? Yeah, the hips flex. So all those muscles, all those strings are going to be shortened. They're going to be slacked. And I'm going to be stretching the stuff that pulls the other way. I flex the hip, and I'm going to stretch extension pulls. I extend the hip, I'm going to stretch flexion pulls. That's simple. That's how things that pull influence motion. If I want to stretch the TheraBand's trying to pull my hands in, so I got to make my hands go out. Look at that strength. Hey, you got to be careful. I don't break this computer by clicking that mouse. And does that make sense? The circles don't tell you who you're stretching. You have to understand who you're stretching in terms of direction of pull, and then your circles help to remind you who those specific muscles are, or your lists help remind you who those are. But nowhere on any of your circles does it say concentric, eccentric. It's direction of pull. Okay? Okay, last one. What group would I be working in this exercise? It's a straight leg raise, but it's a specific straight leg raise to target a specific group. What I need, so the motion is going to be fluctuation between ab and adduction. We know that specific muscles don't do specific motions. Gravity is trying to do what to his right hip? Abduct me. I don't need those muscle pullers. I would slam my leg into the ground. I need adduction pulling muscles to make me adduct through concentric contraction, to hold that position, maybe for this photo, through isometric contraction, and then to lower me back down through eccentric contraction. Make sense? Was doing a little bit of practice beforehand a good route? Okay? All right. So now let's get into the major muscles that influence the hip. That's 310.
Before you move on, can you advance the picture of it?
Absolutely. Did you have a question, or did you want to take a picture of it?
No.
Is it hard to see why it's adduction pullers?
I see what's happening.
Uh-huh. And that would be, and we're going to get into those. In fact, some of these muscles are my favorites because their names are adductor brevis, adductor longus, adductor magnus. Their names are their direction of pull. But what we need to understand is those adductor muscles can be responsible for adduction when they're working eccentric, only when they're working eccentric. So if he turned off all of his muscles, like if we nerve blocked him, his leg would drop. What motion would that be? Abduction. So he doesn't need those muscles that are pulling in the direction of ab. He needs muscles that are pulling in the direction of ab. Does that make sense? And then we're going to learn what those muscles are. Any other, that's my fault, guys. Any other follow-up questions for any of the 3 little practices, examples? Good morning. I should have asked. Any other questions for any of the others? Guys, it's a lot, all right? That's why we're going to spend 2 classes doing this. But we need to understand that for the hip, it's not just about needing, we call it proximal to distal sequencing in biomechanics, but layman's terms, I don't need as many muscles to influence my head because there's not a lot of stuff up here, literally. But I need more muscles to influence my trunk because there's more stuff up here, literally. It's the same concept. I don't need as many muscles to influence my foot and my knee, but as I work myself up, I need more and bigger muscles to influence this kind of stuff, okay? And then in addition, we talk about the stability factor. You dislocate your hip, that is an extremely bad day. Bad day. You dislocate your knee, you can maybe play sports again. You dislocate your hip, you better be Bo Jackson. And even then, he never played football again. Okay, so we have to maintain law and order of our hip stability, as well as generate a lot of force. So those muscles serving multiple functions. I've said it several times. Muscles don't just influence motion, stability and mobility. Stability and mobility. All right, so what I did is I tried to make it easy. This is all stuff I've never given classes in the past. I used to leave those blank and you'd have to come to class to fill in the blanks. But I'm giving them to you. I'm basically saying, guys, this is what you're responsible for in my class. These are the prime movers, the muscles most involved, and this is their direction of pull. Obturator internus, hip external rotator, that's how it pulls. Obturator externus, hip external rotator. Gemellus superior, gemellus inferior, external rotator. Quadratus femoris. So I'm being up front. Here are the muscles you're responsible for. Here's how they pull. Notice we have a few that we've seen before. A few knee muscles that we've seen before. That should be like, oh, okay, I've seen this one before. That's less I got to learn. Or at least it's less in terms of a new muscle and a new function. It's an old muscle and just maybe a new function at the hip. Okay? So far, so good. Here is your knee circle for those of you that learn cross-sectional anatomy. I updated this. Nothing crazy, like I'm not going to say this muscle does a new function, but just kind of fine-tuned it, I think, to make it cleaner. A couple things we need to point out. If you pull up your circle, if you're a circler, a couple things to point out. You have, unlike other joints, you have the rotator cuff of your hip, meaning muscles that only spin, however, very important to stability. Okay? So those are going to be the muscles that are in that middle circle. I like to think of it as a bowl. And the bowl is sitting two fences. The bowl is in the middle of the anterior posterior axis and the bilateral axis. So we've had precedent before where a muscle was on the line where it sat the fence. In other words, if a muscle is in the middle of class, it neither sits on the right side or the left side. It might sit in the front or the back. Well, all of these little lateral rotators, our little rotator cuffs of the hip, they are neither flexors nor extensors nor ab or ads. They only rotate. They only pull in a direction of spin. So I try to communicate that to you by putting that circle on both axes and only drawing a rotation pull from that circle. Does that make sense? That's how I try to communicate it to you. So that way, when you're like, oh, what are my external rotators? Then you could be like, oh, gemellus superior, obturator internus, gemellus inferior, obturator externus, quadratus femoris. Bang, 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 bang. Those are my rotator cuff of the posterior hip. I'm going to show you these muscles. I'm just kind of pointing out some of the uniqueness about the hip circle because we've got a lot going on up in the hip, right? A lot of muscles that serve multiple functions, which is cool. We have, a hip flexor adductor. We have a hip flexor abductor internal rotator. We have some extensor external rotators, but the rules follow the rules. That block of adductors, they're in a box, and that box is on the fence because it was a heck of a lot easier to do that than draw individual muscles. Block is on the fence. So in other words, those adduction pullers, the gracilis, adductor magnus, longus, and brevis, just because the AM is more anterior globally doesn't mean it's not on the fence locally. That box is on the axis. Does that make sense? If it's in a box, same thing here, right? These are your hamstrings. Just because this one is more on the inside, that box is balancing on the fence. Make sense?
So just to make sure I'm understanding you correctly, so the box that we were just doing, the SMST,
We'll go over what they are, but yeah, for now, let's just abbreviate.
only
Hip extensors.
they're not adductors.
That is correct.
Okay.
That is correct. That is correct. So our cross section of the hip is the hip flexors. The flexion pullers are going to be the anteriors. That's going to be your pectineus, rectus femoris, sartorius, iliopsoas, tensor fascia lata. Like literally, not sitting the fence, but everything anterior that's not sitting on the fence. Our extensors, gluteus maximus, semimembranosus, tendinosus, biceps femoris, long head. And again, guys, we're going to go over all these muscles. I'm just showing you how this circle works because there's a lot of stuff in this circle. Okay. Our abduction pullers are going to be our lateral crossing muscles. Lateral medial. Remember, this is a right side. Everything is on the right. But you got the same muscles on the left. So even though I'm doing a left-sided exercise, you're like, oh, I need the abductors. Well, congratulations. It's the same ones on the right side. So you can still reference that right-sided circle. Our abductors are going to be our lateral crossing muscles. Tensor fascia lata. Our famous piriformis that we're going to talk about more in detail, and our gluteus medius and minimus. our adduction pullers, KNES, gracilis, adductor magnus, longus brevis. Our external rotation pullers, those 5 little rotators, piriformis, gluteus maximus. You see how they're trying to spin the merry-go-round this way? And then our internal rotation pullers are tensor fasciolata. And I'm going to specifically talk about certain fibers of the gluteus medius and minimus. I'll show them to you when we go over the specific muscles. All I wanted to do was break down how the circle is compartmentalized, because there's a lot of stuff in here, but it follows the same rules. The ones in the front are going to pull this way. The ones in the back are going to pull that way. Laterals pull this way. Medials pull this way. Then you go to PE, you got lateral spinners and you got medial spinners. Cool? And again, if you don't do circles, no problem. All of that stuff is communicated here. Every single one of them. I even abbreviated it for you because can you imagine trying to spell all those words and get tight, right? Any questions before we get started? Remember, we're going to take 2 days to do these, okay? First, before we go to specific muscles, I just wanted to show you why I separate the muscles individually. There's a lot of stuff going on when you look at everything together. And not only that, muscles are layered. Do you remember the core lecture, the trunk lecture, where like you had like, you know, deep and then you kind of work more superficial? So it's darn near impossible to see one picture where you can see the directions of pull of everything because you got muscles laying on top of muscles. So it is possible to show a picture of everything and say, hey, you see that little part that's sticking out on the side? That's a soleus. So but it doesn't show how that muscle's pulling. So a lot of textbooks and resources, and I have no problem with this, it kind of gives context, but that's too much. You got too many things covering up too many things. So that's why we do them one at a time, so that we can specifically look at how each muscle pulls in specific directions of pull based off of my 2 rules. Does it cross a joint? How does it cross a joint? In front, in back, outside, inside, spin out, spin in. It really is that simple. Okay? Here are, before we go over them separately, I wanted to show you context. We're going to start off to meet with the easiest muscles. These are our rotator cuff of the hips. These are external or lateral rotators. Because in biomechanics, earlier in the semester, we talked about angles. Notice how most of these rotators have almost all X component to their pull. You see how across they pull? And then you got that piriformis, apple, banana, strawberry, sledgehammer. That one's pretty angled. So that one's going to have an additional, I'm not going to say a separate pull, it has something similar, but it pulls laterally because it crosses the hip over the top, where the others don't. They're just literally trying to spin the hip laterally or externally. But more, I say more important, but in addition, they're taking that femoral head and saying, do not leave this socket. Do not go anywhere. You put so much, your body puts so much emphasis on hip stability. Muscles inside of muscles, you have a ligament, a big, thick teres ligament inside that ball. You put a lot of effort into maintaining hip stability. Because again, not now, but our ancestors, that was life or death. In fact, a lot of old people, when they fall and they break a hip, that's a bad day. So hip stability, very, very important. Does everybody see, this is a posterior view. Does everybody see how that X component would pull in the direction of lateral rotation? See what I'm talking about here? Does everybody see that? Okay, now let's go over them individually. Guys, we gotta call it something. And I wish all the muscles could have like names like adductor longus, and I wish. The supinator muscle, oh please. Pronator tear, I wish they had the function in the name. But unfortunately, a lot of these muscles are Latin based. And I was laughing with my wife because I was like, look, man, I'm dyslexic. I struggle with the English language. And now I got to transcribe Latin to English and make it make sense. I get it. But think of it no more as we got to call it something. We all have to have a name. So we got to call these muscles something. So that's all it is. And sometimes they make sense, sometimes they don't. Before we get into the internus and the externus, but like I give you an example. Sometimes like they make sense, and they all technically have some kind of Latin origin. But like quadratus femoris, a square-shaped muscle that pulls on the femur. So sometimes there's like that kind of stuff. But we got to call them something. So obturator internus is one of our hip lateral rotators, external rotators. And look at that X line of pull, right? All it's trying to do is spin that hip laterally, pulling in a direction of external or lateral rotation. You guys remember from 310, external and lateral synonymous? Mean the same thing. Medial or internal synonymous means the same thing. We're going to have a lot more external rotation pullers because a lot of our functional motions of our hip involve hip motion and external rotation on a lead leg. Okay? In addition to the stability factor posteriorly rather than anteriorly. So you got a lot of support from these muscles. Reminder, I'm not going to ask you where these muscles start. I'm not going to ask you where they insert, but I'm going to ask you what they do. I've been very consistent with that. Origin, insertion, nerve innervation, blood supply. Some of you may need to know that one day. But what all of you, I'd like for y'all to know is what do these muscles do based on how they work. So can we just see, like again, leaving out all the fancy jargon, that muscle is literally just crossing the hip and just pulling in the direction of lateral rotation. You can see it. You can just see how it pulls. Obturator internus, and we got an obturator externus. Notice how the internal kind of starts on the ischium. The internus, and then the externus. The internus is more on the inside, and the externus is more on the outside. So it's like a crisscross applesauce here from the ischium. Again, who cares? It's about pull. It's about directional pull. I think what's really neat is that you have a muscle that starts more posterior and a muscle that starts more anterior, but it doesn't matter, they have the same function because they cross the hip the same way. I love those commonalities, that the origin is different, but the function stays the same because both of those muscles cross the same. Yep, external rotation pull. So these are all the muscles that are in your circle on the little bowl. Remember the little bowl? These are all the little muscles on the little bowl. You got your gemellus superior and inferior. I think we know from kinesiology jargon, superior is going to be higher, inferior is going to be lower. Some textbooks just flip it. They'll say superior gemellus, inferior gemellus, gemellus superior, gemellus inferior, potato, Campbell, Brian Campbell. Look at that, superior, inferior. Bang, bang. Notice the same direction of pull. Lateral rotation pull. Bang, bang. Lateral rotation pull, lateral rotation pull, lateral rotation pull, lateral rotation pull. Note, and this is bonus because you come to class and you're listening, quadratus femoris sounds a heck of a lot like rectus femoris. Quadratus femoris sounds a heck of a lot like quads. Right? We have a pronator quadratus in our wrist. That doesn't mean you're going to put it as a hip muscle, right? So just be mindful of muscles that have similar sounding thingies. That's like two different people having similar sounding names, like my twin friends that I graduated with, Heath and Keith. Just be mindful. They didn't look anything alike. Their names, they sound the same, so a lot of people mix them up. All right, let's go outside the bowl. Guys, look how, I think this is really cool. Put your pins down for 1 second. Watch this, how cool. Apple, banana, strawberry, pineapple, grapefruit, sledgehammer. Like, look how different the angle changes for this muscle. You notice how all the previous ones had almost all X component to their pull, horizontal component. This one's more like an oblique, right? This one has much more angulation to it. It still has the external rotation pull because at an angle, it's still going to have the X component, but now it has a Y component that the others did. Now it crosses the hip laterally on the outside. Does that make sense? And I have a different view. Try to have a different view because remember, a two-dimensional picture doesn't show 3 dimensions of concept. Sometimes having a separate view is good. So this, I think, is a good view. The piriformis, or has anybody ever heard in the shoulder? I like to use analogies, as you guys know, of comparative muscles and structures and the shoulder equivalency. In 310, we were like, look, the scapula is like the pelvis is just independent of each other, right? Analogies. So the piriformis here would be like your supraspinatus rotator cuff muscle that's in your shoulder that kind of goes over the top, pulls in a direction of abduction, and very commonly gets impinged and irritated in the head. Piriformis, kind of like the lower extremities equivalent. I think this picture shows better that lateral pull, that abduction pull. And because this is posterior, I think it's easy to see the lateral rotation pull. So it's an abductor and an external rotator. The reason this muscle gets piriformis syndrome, sciatica, is because that sciatic nerve that runs from your spine, the plumbing is different from different people. Some people have that nerve deep to the piriformis. Some people have it superficial. Some people, that nerve runs through the piriformis. Like, there's a lot of variety. When they did cadaver studies, they're like, man, that nerve is all over the place on these cadavers. So sometimes when your wiring comes through, sometimes that nerve, as you develop, could run in different places. If that muscle's tight, it can pinch off on that nerve too. So there's a lot of variability with where that nerve runs relative to that muscle constricting. Does everybody see piriformis, abductor, external rotation pull? Does everybody see why on your circle, piriformis, its function would show abduction, external rotation pull? The abduction, because it's a lateral crosser, and the PE, we go out to spin the merry-go-round, and it pulls the hip in the direction of external rotation. Cool.
So let me get like a picture, so almost like an example. I would use this.
Well, it's an abductor, right? So we need something that's trying to adduct you. So if you're doing a straight leg raise, where your leg is out, like this, gravity's trying to do this, so there'll be muscles that do this.
And one of those muscles would be,
Absolutely, absolutely.
so that's like how we.
That's how it works. So 310, we just said, hey, it's a group of muscles. And all we're saying is who's in that group?
Okay.
Yeah. Who won the 1976 NFL Super Bowl? This team. Well, who were the all-stars of that team? These players. Yeah. In terms of a hip external rotation exercise, that one's kind of tough because you would need like TheraBands or something, but you can lay someone down prone and take a TheraBand with their knees flexed and try to internally rotate them. Therefore, they would be using their external rotation pullers during that TheraBand exercise. That would be one of the muscles pulled in the direction of external rotation. So in other words, if it's an external rotation puller for an exercise, you need something that's trying to internally rotate you. If it's an abduction puller, you need something that's trying to adduct you. It's that simple. Rinse, wash, repeat.
Are all of these pictures in the posterior view?
So far, yes. That's how these pictures, that's the best way to see them, is posterior view, correct. biggest tell is that sacrum right there. There's our coccygeal. Now, the questions, what's the function of the piriformis? How does it pull? So some questions might be exercise related, but most of the questions is, what does piriformis do? It's a hip abductor and a hip external rotator. How would I stretch the piriformis? Well, because it's a hip abductor, I need to adduct my hip. And because it's an external rotator, I need to internally rotate my hip. So if I can adduct and internally rotate, now, not on the test, I'm not going to put this on the test, but in grad school, or if you have questions, the reason people will do this stretch, because 310 people will pick it up quick, the illusion of you think you're internally rotating, but you're really externally rotating. So why does this stretch the piriformis? Well, the piriformis is at an angle, right? It's angulated. So because it's at an angle, let's say it's angled like this, when I flex my hip to line up with it, well, now it doesn't have any rotation pull. Does that make sense? So if I flex a little further, I actually switch its function. Now it's pulling in the direction of internal rotation. Remember I talked about the rectus abdominis can switch its function based off of your position? So that's why if you're gonna, goodness gracious, that's why if you're gonna stretch the piriformis and you're gonna externally rotate your hip, you gotta flex your hip so that you can switch its function as a rotation. Lucky for us, all of our functions on the test are in anatomical position. Trying to keep it simple, all of your circles are based off of anatomical position. But I do want to introduce you to these midway muscle concepts that can switch function based off of your position. Another cool one is our pectoralis major, our pec muscle. When you're adducted or when you're below 90 degrees, it pulls in. When you're above 90 degrees, it still pulls in, but it's abduction pull, adduction. That's why gymnasts, when you can get it 90 degrees, you a hoss, because you no longer have your pec to help you down in this quad. Fun facts. Okay, so when we did our lecture on the trunk muscles, remember one of the, oh my gosh, sorry guys. Like Kermit the Frog's in my throat. Kermit the Frog here. Core, glutes, quads, obliques. And my job is to try to teach us what, the semantics, the variables. So when we say glutes, there are different gluteal muscles. You got your gluteus maximus, that's a big hoss, but you have other glutes as well, including our medius and minimus. Okay? We're going to start off with the medius, but know that the medius and minimus are what we call sister muscles. We've had that before at the ankle, the longus and brevis of the paraneals that have the same function. They may start in different places and they may insert in different places. And their secondary functions of stability, having that muscle insert further so to kind of help stabilize those tarsal bones, doesn't change how they pull in the direction of motion. Okay? So the reason I'm telling you this is everything I'm about to say about the medius trickles over to function of the minimus of our hips. Medius and minimus are like gastroc and soleus kind of, where you have the gastroc on top and the soleus on the bottom. Remember how muscles can serve as pulleys for other muscles? Biceps brachii and brachialis. Our vastus intermedius and then our rectus piggybacks on top of it. So medius gets to piggyback under minimus. So when we look at the minimus, notice how it's going to be. I just want you to visualize that we can't see it because it's being overlaid on top of it. The reason I start with lower extremity is because I think a lot of us have better understanding of upper extremity muscle concepts, even though we don't necessarily give ourselves credit for it. So what do we know about the deltoid? We know that we have like anterior deltoid and posterior deltoid, right? There's like different parts that we could isolate during exercises. It's because that muscle is what we call a fan-shaped muscle. It's one muscle, but because it spreads out in a fan, we can innervate certain sections of that muscle depending on what fibers we need. Now, with the fan-shaped muscle, all of the fibers have to have at least one thing in common. You ever wondered, like, you ever look at a track? Like, this one in college always blew my mind until Dr. George explained it to me. But I think this is important because, again, we're not in a hurry with these. This muscle blew my mind. I was like, there's no way that muscle makes any sense. It's all over the place. I understand a bicep and a tricep. Look, that thing's like, make up your mind, right? And then when I was taught how it works based off of how it pulls, all those fibers actually have two different functions in common, and there's only one thing that the upper fibers and the lower fibers do differently. I'm going to teach you that. But it's a very similar concept with the gluteus medius and minimus. It's a fan-shaped muscle. I didn't realize I was going to go start from the beginning. The earth moving. Let's see if I can do this, guys. Oh no, I know what I did wrong. Yay. It's a fan-shaped muscle, except for our hip, we only need anterior deltoid and middle deltoid. We don't need a posterior deltoid because we got other muscles that serve, like the gluteus maximus and other. So the gluteus medius and minimus would literally it would be like having an anterior and middle deltoid only at the hip. What do the deltoids do? Don't they pull in the direction of abduction, like when you're doing lateral raises, right? They're abduction pullers. Ta-da, abduction puller, because it crosses the hip laterally on the outside. Abduction puller. Okay. This is the weird one. Now remember from trigonometry, or at least one of the lessons of trigonometry, that angles are not proportional to percentage of pull. Remember how like little changes added up to bigger components? Like something that didn't look like it should have a big X component did, because of trigonometry, they're not directly proportional, they're inversely proportional. So you may look at that and say, well, the front of that gluteus medius doesn't have a lot of X pull. And I'll agree it doesn't. But in trigonometry, you don't have to have a lot of X to not have a bigger component of X pull. Does that make sense? Remember from trigonometry? So those fibers of the anterior gluteus medius and minimus not only pull, it's like the opposite of the piriformis. Piriformis was an abductor external rotator. The front fibers of the gluteus medius and minimus are like your anterior deltoid. They're abductors and internal rotation. Make sense? Do the posterior fibers pull? Yeah, but guess what, guys? Gluteus maximus, all those little lateral, you have so many external rotators, insignificant external rotation pull. You do not have a lot of internal rotation pullers. That's why the anterior fibers are prime pullers. They're muscles most involved in internal rotation pull because you don't have near the number or magnitude as the external rotation pull. Watch this. Superficial, deep. Make sense? Underneath, on top. Same functions. All right, let's do some semantics. Not all of those fibers pull in the direction of internal rotation. The vertical fibers Those are only abduction pulls. All the fibers have a pull of abduction, but only the ones that have obliquity to it, only the ones that angle anteriorly pull in the direction of internal rotation. Does that make sense? That would be like saying, I'm working my deltoid and I'm working all of my deltoid. No, you'd be like, I'm working certain fibers, right? I'm working the anterior deltoid. I'm working the posterior deltoid. It's no different, just with spin. Only the anterior fibers have the internal rotation pull. So for your circles, this is where, again, coming to class, drawing notes, notice how the internal rotation pull is in the front of the box. So you need to make a note that only the anterior fibers of the gluteus medius and minimus have that internal rotation pull. The vertical fibers don't. They're just pulling out. They're just pulling straight lateral. That would be like saying my rectus femoris, my rectus abdominis is trying to twist my trunk, right, in anatomical. It's just straight up and down. You have to have obliquity in order to pull in the direction of rotation. Anterior fibers. Guys, we have precedent on this. Upper chest, what do you think that means? The clavicular fibers, like a certain fiber pulls in a certain direction. No different. Just applied maybe in a new way. Anterior delt, posterior delt, up the chest, it's fan-shaped concepts. Upper tract, lower tract, fan-shaped concepts.
Even with that fan-shaped concept and more focusing on the anterior fibers, they can still assist in doing like other muscles, correct? Like the posterior fibers can still assist doing other.
It's so for the purpose, not significantly, but there's a reason they don't assist significantly, and that's because you have external rotator, external rotator, external rotator, external rotator, external rotator, external rotator, and we haven't even gotten to the biggest external rotator. Like you have some horses. Just look at your circle. External rotator, external rotator, external rotator, external rotator, external rotator, external rotator, external rotator. By the time you get to those angled posterior fibers, the gluteus medius and minimus is like, bro, you don't need my help. But look at my internal rotation pullers. All I have is this TFL that I'm going to teach you about, and the anterior fibers of the gluteus medius and minimus. That's all you have. So that's the reason why these are listed as prime movers or muscles most involved, because they don't have any help. They gotta step up and perform. Whereas the posterior fibers, whatever angles they do have, they're like, bro, we have a posse behind us. Right? So that's kind of the differentiation there. I hope that makes sense. It's a great question. All right, how about we stop and do a couple more applied practices. Let's see, how about we do it's actually hard to find hip rotation exercises, but I brought a TheraBand, so if I can't find one. Oh, here we go. How about we do a stretch concept? Let's see. Oh, we can do a muscle. Okay, so let's say, this is pretty cool. So there is no external force that's trying to rotate the hip. True? So that means I gotta make it rotate through concentric contraction. So this is just, again, it's hard to find isolated hip rotation exercises. But if I'm gonna have to make my hip internally rotate, that's what we did from left to right, internal rotation. Does that make sense? Hip internal rotation. I gotta use my hip internal rotators. my anterior fibers and my gluteus medius and minimus, and then one coming up that I'm going to teach you, the tensor fasciae. TFLs has a lot of functions, so I don't want to speed through it. We'll start off. If I go from right to left, I'm going to externally rotate my hip. So I need my external rotation pulls. Gemella superior, inferior, obturator, internus, externus, quadratus femoris, gluteus maximus. I mean, we haven't talked about it. See anything that pulls that way or the
And that's only because there's no force acting against.
Yeah, in this exercise. But if we did, I probably shouldn't have done this one. But we could do a stretch, like if I came to the lady on the picture on the left and I emphasize that external rotation, I'd be stretching her internal rotators. And likewise, if I emphasize that internal rotation, I'd be stretching external rotators. So let's say, let's imagine somebody, this might be a good one. It's really hard to find hip rotation exercise. But you can do them. Let's see if I could, because you can put therabands in between. Ah, there we go. That's not too bad. Ah, perfect. Yay, I just had to add that theraband. Don't think about muscles. Think about groups. Her right hip, that TheraBand is trying to do what? Internally or externally rotate her? Good. The TheraBand, does everybody understand that? That the TheraBand is trying to externally rotate her hip? So what group of muscles would she need? She doesn't need external rotation pullers, she would need internal rotation pullers. Does that make sense? Now that you've identified who you need because you see why you need them, that's where your circles or your lists say, well, who are those internal rotation pulling muscles? The anterior fibers of the gluteus medius and minimus, and this new muscle that I'm going to teach you on Friday, the tensor fasciae. They pull in the direction that we need against an exercise. So if she makes her foot go out, that's going to be the concentric phase, right? She's got to make it happen. And if she lets her foot go in, same muscles. But the motion is different because the contraction is different. Still be the same muscles, but just eccentric and concentric. Say that one more time. No problem. Do you mind repeating that?
I don't understand how the TheraBand is externally rotating.
Well, it's trying to. And that's an illusion that I emphasize in 310, that this is external rotation, the motion. This is internal rotation. So we don't follow the foot. Does that make sense? So the TheraBand is pulling her foot in, true? Okay? Pulling the foot in is trying to make her externally rotate. Ah!
That makes sense.
That was awesome. Those light bulb moments is what I live for.
That makes sense.
Yeah.
I think arrows reminds me of too.
Well, the arrows, but also the foot. The TheraBand is trying to pull the foot in.
Yeah.
It's trying to make the hip spin out.
Yeah.
That's weird. Does that make sense? And that's why we spend so much time on those illusions. That's not your fault. You weren't here for 310, but how much time we spent, don't follow the foot. Right? That's why. Okay? And that's what I need. If there's any kind of those questions are very important. Keep them coming.
I've never seen the Rotex machine.
Say that again?
Rotex, it's like you stand on it, it's like resistant, going in and out.
Let me, I've been out of the rehab game since my athletic training years. Rotex.
Yeah, T.
Are you sure? I'm joking.
Yeah, it's like.
Oh, really cool. Look at that. Now, now the reason this could be, I would need information. I would need to know, I would need to know how it's resisting. Is it neutral here? And then it's like, does it switch function? Like if I external rotate, it's trying to bring me in. If If I internally rotate, it's trying to bring me out. Can I reposition it, almost kind of like the ad machine where you can reposition it at different starts, or is it constantly
So it's like this, but the way you kind of reposition it.
Yourself. You can reposition yourself, is what you're saying. So like, I could choose to start here and make it come in, let it go out. That's cool. Super hard without the context of like the weight stack going up and stuff, but I really like that a lot. Yeah, I'll try to play around with that to see if I could, give enough information. So like, in other words, so for this one, assuming she started, in a neutral or anatomical position, as she internally rotates, the machine would be trying to externally rotate, right? Gotcha. That's cool. So she'd be using her external rotator. No, she'd be making herself internally rotate, so she'd be using her internal rotator, because the machine is trying to bring her back. That's cool. Gee, look at the time. All right, guys, we're done.
I think I've figured out my biggest issue.